Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Causes of hemoptysis. Hemoptysis is seen in infectious conditions like tuberculosis. Hemoptysis can occur mainly due to the rupture of small blood vessels. Rupture of bronchial vessels can result in hemoptysis in tuberculosis. In lung abscess, hemoptysis can occur. Even lung abscess is actually a suppurative or it is a bacterial infection in the lung which has resulted in formation of abscess. So in lung abscess also uh, there is chances of hemoptysis is also seen. Bronchiectasis. In bronchiectasis is actually a dilated airway disease, or there is ectasia of airways is seen in bronchiectasis. So in bronchiectasis also there is dilated airways which causes pooling up of secretions will occur, and because of this pooling up of secretions, these will get infected, and because of infection there can be hemoptysis. In pneumonia is actually the consolidation which is present in the lung. This consolidation can be due to an infection most commonly. So because of this infectious cause will cause hemoptysis. Then in fungal infection like aspergillosis, nocardiosis or blastomycosis also we have seen hemoptysis. Hemoptysis is also seen in neoplasms like in bronchogenic carcinoma, bronchial adenoma, or metastatic tumors of the lung. Hemoptysis can be seen. Then cardiovascular diseases like mitral stenosis. In cardiovascular diseases like mitral stenosis, pulmonary hypertension, aneurysms, arteriovenous malformations, and pulmonary embolism. In all these conditions, hemoptysis is common. Then congenital conditions like bronchial cysts, sequestration of lung, especially intralobular or extralobular sequestration of the lungs, bronch hemoptysis can occur. Hemoptysis can also occur in collagen vascular diseases. In collagen vascular diseases, there will be weakness of the collagen present in the lung, which will predispose to fragile blood vessels, leading to hemoptysis. So, this collagen vascular diseases causing hemoptysis include vasculitis, Wegener's granulomatosis, Goodpasture's syndrome. Then we have traumatic hemolysis. In traumatic hemolysis, these traumatic hemolysis can be of two types. One, we have non-iatrogenic causes. Second, we have iatrogenic causes. In non-iatrogenic causes, especially blunt injury or inhalation of toxic gases or acid aspiration, both these can result in hemoptysis. And in iatrogenic injuries, that is when the some intervention while doing some intervention also hemoptysis can occur, like diagnostic biopsy procedures or therapeutic anticoagulants. In these hemoptysis can occur. In radiation fibrosis also hemoptysis can occur. Miscellaneous disorders like bleeding disorders are also associated with hemoptysis. Hemoptysis is not common in certain conditions. It is not common in metastatic lesions and viral infections.
thank you and thank you for watching.